Hi guys, and welcome to our live Facebook video for this week. So today, in keeping with our theme of your glute medius and strengthening your glute medius, we're going to be talking about glute pain and weakness and pain during running. So a common complaint that we see from a lot of people is that they get pain in the outside of the hip, so around this region here, when they're running. And the typical story will be that either they have just started running recently and they've gone from either no running to running 3 or more times a week for long distances or for a long period of time, or they've gone from running short distances to running longer distances, upping the ante with no real strength training to sort of improve the strength in their hips. So if you've not got strength in your hips, you're not going to be able to cope with the increased load that is associated with running. So a little bit about gluteus medius. So it's located about on the lateral aspect of your hip. So lateral means outside. So again, this area around here. So you've got your big muscle called your glute max, and then deeper to that is your glute med. And the aim of this muscle, or the purpose of this muscle, is to create a little bit of stability in your pelvis, particularly when you're running, and to make sure that everything is nice and supported, especially when you're standing on one leg. So if you have a little bit of weakness in your glute med, it can lead to excessive sort of sideways movement of your hip. And what this means is that when you come onto one leg, when you're running, you'll have increased shift of your hip to the outside. So like that kind of movement. So you can already see that you're putting a little bit of extra pressure around this outside of your hip. This can also happen when you're standing on one leg. So if your hip sinks out when you're standing on one leg, so that way, or when you're walking, again, you'll have that excessive translation, the sideways movement of your hips. This can then lead to a lot of other issues. So if you're thinking you're already sitting outside with your hip poking out, it's going to be placing a little bit more pressure on your knee because your thigh bone is now sort of angled more in rather than a nice neutral alignment. So you can get a little bit of patellofemoral joint pain, which means knee joint pain. You can also get a little bit of lower back pain because the glute med helps to stabilize the pelvis. So if you've lost this stabilizing muscle, you're going to have a lot of other muscles trying to compensate and take over, which can then cause a little bit of tightness throughout your back. And you can also get ITB syndrome. So a lot of people with hip pain will also have a lot of tightness around the outside of your leg. And that's that bit of tissue that nobody likes to foam roll. Along with having weakness in your glute med, it's typical for a lot of people to present with some other issues as well. One of the most common ones I've seen is increased tone in your hip flexors. So what happens is, because you've got this muscle here, your glute med, which is a little bit weak and it's not doing its job in stabilizing the pelvis, your body will compensate by creating tension in other muscles around this sort of area. So your hip flexors, which are your quads, and then some other muscles in and around your pelvis, as well as your hamstrings. So the first muscle to get tight will be your hamstrings, to sort of pull your pelvis down a little bit, and then to counteract that movement, your hip flexors will get tight to stop the excessive shift of your pelvis backwards from your hamstrings. So they kind of work together in creating that stability. So a lot of the time, what I will see is when people come in, they're getting the pain in the outside of the hip, but it's also happening around the front. And then they're also unable to contract their glutes in isolation. They're usually using their hip flexors or their hamstrings to try and get that little bit of tension. So today I'm going to show you a couple of exercises that you can do just to release these hip flexors at home and try and take away a little bit of pain. And then we're going to move on, and I'll show you another exercise that you can do to release a muscle that sits deep in your hip, which can sometimes take over for your glutes. So what you'll need is a bit of floor space. So we're going to come over here. So you lay down on your back, and what you're going to feel for is around the front of your hip, so around this area, just inside your hip bones. I want you to have a little feel and find any points of tenderness. If you're not tender, that's fine. You don't have to do this exercise. This is more so for people who are having a little bit of hip pain when they're running, or hip pain in general. So if you find a nice little tender spot, so for me it's about here, what you'll then do is bend both knees up, keep your fingers on that spot. You're going to take a deep breath in and just relax your knees down to the left. So if you found that the left hip flexor is tight, you will move your knees to the right. So my right hip flexor is tight, so I'm going to drop my knees to the left. I'm going to hold, come back up, take a deep breath in. So on the breath out, I want you to imagine that you're sinking your thigh bone in through your back pocket. So just relax and let it sink down. And relax and let it sink down. Okay, we're going to do this 5 times. So again, letting your knees fall down to the opposite side of the sore hip. And hold there for 5, 4, 3, 2, 1. Coming back up, deep breath in. And deep breath out. And just let that hip sink deeper into its socket, like it's about to push through the back pocket of your legs. And again, so this is 3rd time through, letting it fall down. Holding there, 5, 4, 3, 2, 1, and relax. Deep breath in, and deep breath out. And again, we've got 2 more times, so letting it drop down. 5, 4, 3, 2, 1. Coming back up. Deep breath in. And deep breath out. And just really relax all the muscles around that hip. I'm going to do this one more time. Holding there, 5, 4, 3, 2, 1. Coming back up. Deep breath in. And deep breath out. And relax. Okay, now straighten these legs back down. Now I want you to have a feel around where that sore spot was and just have a poke and a prod. Is it still sore? For me, it's not as tender, and it should be less tender for all of you if you've done this correctly. So I can't feel any points of tenderness. So you can do it on the other hip and try and see if you can find another bit of tenderness around that side and repeat the exercise. So you want to be doing it about 5 times through. And you want to do this exercise morning and night, just because getting up before you get up in the morning, you're going to be releasing some of that muscle spasm and muscle tension, which can help alleviate some of your pain and some of your symptoms. And doing it at night, again, same thing, it's going to relax your hip and help reduce some of those symptoms so that hopefully you get a better night's sleep. Now, this isn't the be-all and end-all exercise, you know, just because we've reduced some of that muscle tension in your hip flexors doesn't mean that we've fixed any of your hip pain. It's just to give you a bit of pain relief. As always, if you're getting a little bit of pain, make sure you do come into the clinic so that we can really get to the bottom of what's going on. The next exercise we're going to do is that deep hip muscle relaxant that I was talking about. So the muscle we're targeting is called obturator externus, and basically what studies have found is that if people are weak in their gluteus medius, they'll be compensating with the obturator externus to sort of create stability in their leg and create a little bit of movement that the gluteus medius would otherwise be doing. So to release that, what you need is either a wall or a resistance band. So I'm going to use a resistance band. Now you'll need something that's quite firm, so I've got a black one here. And what you're going to do is place this around your legs, and sit it just up above your knees. If you don't have a band, lay yourself down on the floor next to a wall with the side of the sore hip next to the wall. What you're going to do, so if you've got the band, you'll loop it up. Make sure it's nice and tight. What you're going to do is push your hip out against the band, so just the hip that you're trying to focus on. You're going to hold that there for 5 seconds, and then you're going to come back in. So if you're using a wall, you would push your leg into the wall. Just nice and gently, it doesn't have to be a big forceful contraction, just nice and gentle push. And then you're going to take a deep breath in, and deep breath out, and let your pelvis relax down. So this is a good exercise to do before you try and do any glute work, so that you can really try and target that glute medius on the side of your hip just by relaxing the deeper muscles. So we're going to do that again. So push out. So I'm pushing my right leg to the right and holding. 5, 4, 3, 2, 1. Back up. Deep breath in. Deep breath out. And imagine that your pelvis is flattening against the bed. Do this 5 times. So again, hold. 5, 4, 3, 2, 1. Coming back in. Deep breath in. And deep breath out. And relax that pelvis down. 2 more times. So pushing out. Holding. 5, 4, 3, 2, 1. Coming back in. Deep breath in. Deep breath out. And imagine your pelvis is flattening. And last time, pushing. 5, 4, 3, 2, 1. Going back in. Deep breath in. Deep breath out. And relax. Now what we're going to do is try and see if you can isolate your gluteus medius on the side of your hip. So for some people you will have different positions that will be easier. First of all, we're going to try with your knees bent up. So don't worry if you can't feel your glutes firing, move on to a different position to try and make it a bit easier. So place your hands on the outside of your hips, just below your hip bones and towards the back. And what you're going to try and do is draw your thigh bone deeper into your hip socket and squeeze the outside butt muscle. So what you'll feel is a little bit of tensioning on the outside of your bottom, okay? Now what we don't want to see is a little bit of tightening in the front of your hips or in your hip flexors, and you don't want to be feeling any tightness in your hamstrings. So if you are, that's okay, bear with me, we'll change the position to make it a little bit easier. But if you can, try holding that contraction there in the side of your hip for 5 seconds without using your hip flexors, without using your hamstrings. Okay? If you find that's really easy, you can try and hold for 10 seconds. And if that's really, really easy and you don't have any pain, then that's fine. That's really good. If you're struggling in that position, what you can do is roll onto your tummy. And you're going to bend your knees up, have them a little bit separated so not together, kind of spread apart a little bit. Bend your knees up, touch your heels together, and you're just going to try and squeeze your glutes there. So you can see when I do that, my pelvis is kind of flattening a little bit. And you're going to hold that there. 5 seconds. 3, 2, 1, and relax. And again, so try and tightening that muscle on the outside of your hip, so about here. And hold. 5, 4, 3, 2, 1, and relax. Again, what you don't want to see is that you're really pulling through your hamstrings and squeezing through there. It can make it a bit hard. And you're just using a muscle that you already know how to use. You're not targeting that muscle specifically. So again, one more time. Try and squeeze there. 5, 4, 3, 2, 1. So, if you find that you're really struggling to find your glutes and you do have a lot of hip pain, please do book in for an appointment or for a video consult so that we can really get to the root of the cause of what's going on and give you a targeted exercise program. So we have a little gift for you all. So the first 2 people to message our page with their name and email will receive a free 10-minute video consultation with me, and that's just an opportunity for you to go through any aches and pains, chat about any injuries that you may have, and we can look at putting in a little exercise program or treatment program for you. So make sure you message us. Again, first 2 people to message your name and email will receive a free 10-minute video consultation. If you have any questions, please leave a comment below and I will answer them as soon as possible. Thanks for joining in, guys.